Welcome to the Dartmouth High School COVID-19 vaccination clinic for March 6, 2021. We have 1,030 appointments today. We have representatives from the Dartmouth Police Department, Dartmouth Fire District 1, Stat Ambulance, UMass Nursing, Dartmouth Public Schools, a variety of offices at the Town of Dartmouth Town Hall, and we also have Town of Westport. The reason why I refer to this as the Dartmouth High School site is because this isn't about a Town of Dartmouth endeavor. This is a pandemic. Pandemic doesn't recognize the municipal boundary between Dartmouth and New Bedford, Dartmouth and Westport, or even Massachusetts and Rhode Island. We have to be serving to everyone if we're going to get through this. So that's why we call it the Dartmouth High School site. So earlier in January, we combined our forces with Westport and University of Massachusetts Dartmouth so we could act as a consortium and learn the vaccine so that we could make today possible. Despite all of our planning, we had never planned for actually COVID-19. And unlike other injectable vaccines, there was some uniquenesses to our responses with this clinic. And one of which is right behind me, as you'll see, which is this observation area. We have to have a 15 to 30 minute observation. And also we have to maintain the social distancing to make sure that we don't increase people's risk of transmission. So while at the end of the second dose, people are fully vaccinated, there's still a period of time before you reach your ideal immunity. So we don't want to bring in any risk at these clinics. And we strictly manage the flow to assure that there isn't any compromising of the public health standards with the 6-foot separation or anything else along the way. You'll have an opportunity to see outside some of the planning that went into this through emergency management with all of the wheelchairs and barriers to assure that everyone is provided an extraordinary level of care and comfort.
Some of the planning Chris mentioned through emergency management and other in the school department is the setup of the actual facility itself. There's several levels. I said we have the welcome area up front where we have a couple of police officers and some emergency management personnel. What they're doing out there is they're providing security, first and foremost, to our facility. Secondly, is they're assessing people as they come out of the vehicle. There are a lot of people, especially some of our elders, who are very independent. But in order to get them through this system as seamless as possible and without any type of stress on them, we offer them a wheelchair. Some of them are resistant at first, but at the end of the day, a lot of them will accept it from us.
Good morning. You can go right on in. Welcome back.
Once we get them into a chair, we bring them to the front, then they're welcomed again up front by someone from the Council on Aging. Amy DiPietro and her team up front, again, they're looking at their elders. They haven't seen them in a long time because of COVID, so they're kind of getting caught up with them a little bit and actually assessing them to see how they're doing. We get them through the system. They head back down to the next level, which is the first check-in, to make sure that they're on the list and all their information, the paperwork's complete, and that's at the entrance to the gym. Once they come into the gym, you'll see some barriers. We try to make it easy for people to get them in the right direction. Then they go to the medical side, which is we have the nurses from DHS and from other facilities that are here, and they're doing their medical evaluation of them. They come forward, then they get to the vaccination site, where we have 8 stations here today. They're there, and then they work their way to what Chris was saying about the area they sit down. This is the final evolution of our plans. Every time we conduct a clinic, we have a debrief at the end and we talk to the staff and find out what can we do better? What do we need to make this go more seamless, and make their jobs easier and more comfortable for all of our people that are coming through. So what you see here today is the final evolution. It's unfortunate that it's, unless the state changes their mind and gives us more vaccine, this will be the final one here. It's sad because, again, over 1,000 people in less than 6 hours, I think, and again, I'm biased, but I think that we do a great job. The people here do an outstanding job. This plan started in 2000 when the state, which is kind of ironic, the state mandated that we have a pandemic plan in place to be able to inoculate everybody in the town of Dartmouth within 48 hours. We developed this plan under the old health director, Wendy Henderson. And as the years have gone by, we've streamlined it. Chris came on board and we streamed it out a little bit more to where we have this today. So that plan helped us out a lot to get things moving. I can't say enough about the staff from the emergency management, the police, and everybody else that Chris mentioned that are here at 7 o'clock in the morning for an 8:30 start. They're here the day before, setting up in the gym once the kids leave. There's a lot of dedication, and again, it's unfortunate, but I'm proud to say that all of these people are here for the town, they're here for our residents, so that makes me proud.
Have a good afternoon. You're very welcome.